Welcome to Feed Your Lion. I'm Dr. L.I.O.N, and I'm here to aid you in the mastery of total health, spiritual, mental, emotional, physical, and financial. So prepare to have your wellness tank filled up with this podcast. Welcome back to another episode of Feed Your Lion. Today's special guest is Dr. Jessica Suber. She is a board-certified plastic surgeon, and she's here today to give us the down low on everything plastic surgery, or at least some of it. So thank you for being with us today, and go ahead and let's talk a little bit about your background. So how did you get into plastic surgery? What does the training look like? All of that.
Sure. Well, thank you so much for having me. It's always a pleasure to work with you. I enjoy my time with you so much. So plastic surgery, the training is, you've got two routes you can go, really. You can go an integrated plastic surgery program, and this is right after medical school when you're applying for residency. The integrated route is about 6 years of intense plastic surgery. Okay. The other way you could go is you could do about 5 years of general surgery and then do a 3-year fellowship.
Okay.
But those are very limited spots, and they're pretty hard to get into. So generally, you need 2 years of research. So it's about 10 years to do it that route.
Wow.
I went into an integrated program, which was great because it was basically just 6 years of intense plastics training. You can also do a fellowship after that to kind of specialize even more, and we can kind of go into that later on. But I am born and raised from Florida, and I went to Florida State University. Go Noles, even though we're not so good anymore. But I went there for undergrad, and then I continued there for medical school. And then I did my integrated plastics program at University of South Florida in Tampa, Florida.
Awesome. So how competitive is the integrated program compared to like doing the general surgery route first?
Yeah, it's pretty competitive. There's about, at the time I applied, there was like 90 spots, and now there's probably maybe 100, 105.
Okay.
And usually 500, 600 applicants.
Yeah, so you think about that, guys. That's across the country she's talking about. So you've got a 1 in 6 chance of basically usually around there getting in. So that's a pretty competitive field. There's a lot of medicine that's like that, but not surgery is one of the most competitive of all the residency spots. So, so the training, talk about to that a little bit. In that 6 years, are you doing like general rotations? Like, you know, if you're doing a regular residency, you'll have to do so many in, you know, maybe the emergency room or internal medicine or pediatrics. Do you have to do any of that in the integrative?
Sure. We did about a total of 12 months of general surgery, and that included a little bit of vascular surgery too. But then plastics is kind of divided up into like burn surgery. You do rotations of that, rotation of pediatric craniofacial at the pediatric hospital. We would do reconstructive for cancer. Then there'd be a cosmetic side, and then there's also hand. So there's a couple of different branches of plastic surgery that most people aren't even aware of.
Yeah. Okay. All right. So let's talk about the specific procedures you tended to focus on. Like, what area of plastic surgery did you go into? Why did you pick that? And what are some of those bread and butter procedures that you do with it?
Sure. Well, because I am a plastic surgeon in a rural area, and I'm the only plastic surgeon there, and I work for a hospital, I pretty much do bread and butter plastic surgery. So I do a lot of breast work, you know, breast reductions, breast lifts, breast augs, breast cancer reconstruction. I do a ton of body work. So a lot of people that have lost weight, you know, massive weight loss. Yeah. I do, you know, arm surgery, which is brachioplasty, belly surgery, tummy tucks, leg, thigh surgery. Another thing that's real popular for me is eye surgery, eyelid surgery. That gets covered by insurance because it decreases your vision. So I do a lot of brow lifts, eyelids. I treat melanoma. I do wound surgery, burns, carpal tunnel. I dabble in a little hand surgery here and there. So a really good variety.
So if you were in like a bigger city or something like that, you wouldn't be as generalized, right? Like you would usually pick something that you're kind of like, that's your thing, or is that?
Well, a lot of times we like to do general stuff to keep up our skills.
Sure.
But when you're in a bigger city or at a university kind of based academic medicine, yeah, you're going to kind of pick more of a niche and stick with that.
Sure. Okay. So what drew you to plastic surgery in general? Like, why did you want to do it?
So I was a medical student, and I did a rotation at University of Alabama, actually, and I was blown away because one day we made an ear for a 6-year-old little boy who was born without an ear. Then we made a breast for a lady that had breast cancer, and just the variety I thought was really appealing.
Sure.
A plastic surgeon will operate from the head to the toe, and we operate on all levels of skin and even bone sometimes. So to me, it was the variety.
Yeah, absolutely. So you talked a little bit about this, but like, let's break down again the specialties. So if a plastic surgeon, you said they can do an extra like fellowship in something if they want to like specialize. So what are those like?
Absolutely.
What typical programs do they have?
So one route is craniofacial, which includes cleft lip, cleft palate, all the surgeries that kind of do facial advancements and a lot of bony work of the face in kids, pediatric. So that's one route, and that's about a 2-year fellowship. Hand surgery, it's either an orthopedic surgeon or a plastic surgeon.
Okay.
So we would do replants. Someone cuts their arm off, fingers off in a saw accident or a car accident. We would replant the finger or the hand or the arm if it was able to be. So we do carpal tunnel, even distal radius fractures, finger fractures, tendon surgery, reconstruction, all that kind of stuff. That is also in a plastic surgeon's wheelhouse if they do a hand fellowship.
Yeah.
Cosmetics, obviously, that's a big one for us. Some people do a cosmetic fellowship, but in my training, I had a lot of experience in cosmetics, so I didn't feel like I needed that.
Yeah.
Microsurgery. So microsurgery is when we actually will take one body part or like a muscle from a certain area. Usually we'll use your back or your belly, and then we replant it to another body part to cover up a large defect. And that is, the micro part is you're underneath a microscope because you're sewing an artery to an artery and a vein to a vein with a tiny little needle, and it's very tedious. But that's a surgeon, right? So the brain surgeon calls us or neurosurgeon calls us if they've got a big exposed brain and they need that covered. The general surgeon calls us if they need reconstruction for a breast or something that they have done. Even the cardiovascular surgeons, if they've got exposed heart or something that needs a big flap, that's usually what we have to do.
This is off topic, but I know they've got a lot of stuff going in like 3D printing and stuff. Or do you think they're going to start doing more of that, not using like taking it from other places? What are your? I know that's kind of off topic, but I'm just
I mean, for ears and stuff, they are starting to do that more, and for smaller areas, it might work, but some of that stuff just won't survive, and you need the blood supply to keep things alive, and that's where we bring the blood supply in because we sew it up to an artery to give that tissue blood supply.
Gotcha. Okay. All right, so we got the craniofacial, the hand, and then the cosmetic. Anything else? Or was those the big areas?
Yeah, those are the main ones.
Okay. So what is your favorite procedure to do and why?
Oh, my favorite procedure is a tummy tuck. It's instant gratification.
Okay.
The patients are just so happy, to get rid of that extra loose skin, tighten up their belly. Because it's something that they can't achieve at the gym. I mean, you can work out till you're blue in the face, and your muscles aren't going to go back to normal, and you can't get rid of that extra skin.
Yep.
So that's definitely one of my favorites.
So, and you said that you're typically looking at somebody who's lost a lot of weight, and it's more you're cutting out that extra skin, right?
Yes,
and pulling it back together there. Okay.
Yes. Or if you've had multiple pregnancies and your muscles, that rectus diastasis, they're separated, and just to bring that kind of back together to get that waistline.
Yeah. Okay. All right. So what are some of those, let's talk a little bit about, we've heard of some of those botched jobs or those dangerous plastic surgeries. What are some of those top ones that are like really dangerous, and why, and what should people know about like going into that?
Well, one of the big hot topic, these days in plastics is dangerous surgeries is the BBL, or the Brazilian butt lift. And what a lot of people go to Miami and they travel for this procedure because, that's just where it's popular. First of all, the biggest thing is checking credentials. You want to go to someone who is a board certified plastic surgeon, not, who claims that they're a board certified plastic surgeon. They need to be certified by the American Board of Plastic Surgeons. That's totally different than taking a aesthetic course on the weekend and getting this kind of cosmetic credentials. It's completely different. They could be trained on a weekend for that. And so a lot of them will advertise they're board certified, and you need to find out in what. And there is a great website, the American Society of Plastic Surgeons. You can go and you can look up any surgeon, and you can find all the board certified plastic surgeons there. So that's step number one. Because step number two is just to make sure you're not trying to push the limits.
Yeah.
And this is where you get hurt or killed. 1 in 3,000 people actually die from this procedure. And that is very high.
Yeah.
That is extremely high rate of mortality. And they're trying to put in place
put in place.
I can't talk today.
There we go. We got
some laws about how much fat you can actually inject, because that's what's dangerous. If you're overdoing it and you're injecting deep in that muscle, you have a high risk of injecting that vessel. And if you inject blood in that vessel in your buttocks, it's going to go straight to your heart or your lung, and it's going to kill you. It's called a fat emboli, and there's no way to reverse that. There's no way to survive that, and that's really scary. So putting a little bit of fat in your subcutaneous tissue is generally pretty safe. They have this ultrasound now that we watch where we're injecting the fat to make sure it's more safe, but you never want to inject deep. And what happens is, down in Miami, everyone's trying to get the biggest butt. And the way to get a big butt is to inject more fat. So you don't want to do that. You want to be conservative. You want to go to a doctor who does this a lot safely and who isn't trying to overdo it, and don't have crazy expectations, because that can really hurt you. And then injecting anything but fat in your butt is not a good idea either. People are doing this on the street with silicone products, and it will cause kidney failure. The only way to fix it is to cut it completely out, so then you have no butt left. I mean, it's a disaster.
Well, and we've talked about that. I mean, the aesthetics course I'm doing, even silicone is pretty popular, but even in the face they're doing that. And then if it goes wrong or they've put too much, there's no other way to get it out. They have to cut it out. It's the same thing with anywhere you're putting these things. So, and like she's saying, if you're going deep so you can put more fat to get a bigger butt, they're injecting vessels with the fat, and then it's going to travel and it can kill you. It goes to heart, lungs, everywhere else. So that's why it's so dangerous. But 1 in 3,000 is just really a crazy risk for something cosmetic. I mean, that's really, like you said. Anything else procedure wise that you see that people kind of are a little dangerous or flippant with, I guess I should say?
Well, even high volumes of liposuction can be very dangerous, changing the volume. And that's why most states have laws. I mean, every state actually has a law of how much you can remove at one sitting. And then also putting too many combinations of surgery. Like if you're going to get your breast done and liposuction and a tummy tuck and your leg lifted, you don't really want surgery to be more than 6 hours without staying overnight somewhere. You can have a longer surgery as long as you're staying and being monitored somewhere. So you want to make sure they have that in place, and it's a very, you're getting monitored safely with the right type of credentialed people.
Sure. So again, guys, go on that online site to look and make sure that your plastic surgeon is board certified and it's not just a cosmetic class. So that's really important. And then as far as we talked about the liposuction. So Dr. Suber's doing liposuction actually in our office now at L.I.O. Health and Wellness. We're doing the in-office lipo. She's done liposuction forever in the OR. And so we're doing this now as an awake liposuction. So speak a little bit to the differences. We talked about that. Each state's different. And when she was talking about how much you can take out, that's how many liters of fat can come out. Okay. And you also have a rule of how much numbing you can put in, because too much numbing can cause all kinds of issues. Lidocaine can actually cause arrhythmias and all kinds of things with the heart. So you do have limits on these things, but speak a little bit to your experience with the differences of doing an in-office liposuction versus asleep in the OR.
Yeah, sure. So in office liposuction is perfect for someone that just has some stubborn areas of fat that they just need a little contouring here and there, not in combination with a lot of other things. It's just straight liposuction. And we give you some things to help you feel a little sedated and relaxed. And then we make a small incision, inject a little bit of that lidocaine, and we inject real slow, but usually patients tolerate it really well, because then once the injection is done and you're numb, you don't feel anything. And then we do the liposuction so you're awake. The great thing is you can hop off the table, stand up, and you can see your changes immediately, but we can also make sure there's no contour deformities. When you're laying on an OR table and you're asleep, you can't stand up and do that. So it's really difficult to judge what your body's going to look like while you're standing when you're completely awake. And, I love liposuction in the operating room because the patient's asleep and I can be very aggressive and do lots of stuff. But that's generally only for patients that are undergoing other combination surgeries, like they're getting their breasts done or their bellies or their arms or something else, and doing liposuction.
Yeah. So a couple things I want to say with that. So first of all, I can speak to the weekend training you're talking about. Like, I'm an ER physician, board certified, right? But I don't do any surgeries. And when I got that in-office liposuction machine, and I told you this and you were kind of surprised by this, they did it was a 1 day thing where I went and watched somebody and they let me have a little hands-on, and I had never even seen a lipo because I didn't do any of that in my surgery rotations. Yeah. And then there was somebody who came to the office while I did it. So it was a 2 day for a straight up surgical procedure. And I had no experience with it, and they're like, "Okay, well, you're good to go now." Which
no offense, that's scary.
That's scary, right?
Scary. Scary.
It's something I wasn't comfortable just going off the bat. I'd need a lot more to do that, and I can say there's other physicians I know who aren't surgeons, but they've done thousands now because they've been doing it, and that's one thing. But I just thought that was kind of crazy. So those things are out there, where they just.
Well, because they want to sell their product. They want to sell their product.
And it does. So that's I can give firsthand testimonial to that, I guess. And then the second thing I want to talk about. So you mentioned these multiple procedures. They talk about the mommy makeovers. Those are huge now, right?
Yes.
And usually you're doing something with the breast and belly and that typically, right? And then whatever else. They're adding in arms, legs, whatever at this point. But I've seen a lot of people going even down to Mexico and getting these procedures. Have you seen that in your office at all? I'm just curious.
And it's scary because you could die, and what happens is they come back. And they might have a terrible complication, and then there's no record, so we don't have a record of what happened. Right. We have no way to track this down. We're guessing, and then you can get really sick. It's really risky. I don't recommend that at all.
Yeah. Because like I said, they usually will do a breast and abdomen procedure, but who knows what else they're adding in, and you're not knowing, and then you're coming back to somebody who's actually doing this all the time, and this is their job, and they're board certified, what in the world? So I would advise you guys to be really careful with that stuff if that's something you're considering.
I say you get what you pay for.
Yes.
So you know what? You don't want to catch a deal on plastic surgery. You want to go to someone and, maybe pay a little more, but it's worth it because you're going to save yourself a lot of headache down the road.
Yeah, this isn't the time to look for your discount, right?
No Groupons for that.
No Groupons. Yeah. All right. So what do potential clients need to know, prior to consult? If somebody is interested, if they want to get a hold of you specifically, or come into an office for plastic surgery, what do they need to do? What do they need to bring? What do they need to be aware of prior to?
Sure. So, when you're thinking about plastic surgery, the ideal candidate for plastic surgery are someone that's got a normal BMI or very close to a normal BMI. You're just going to have a better outcome. If your BMI is higher, it's going to increase your chances for wound problems, non-healing, all kind of scarring, things like that. If you're a smoker, you want to quit smoking. We won't operate on smokers because I won't actually do a breast surgery on anybody who smokes, or anything really, because your nipple can actually die. That's over our stop sign.
Okay, we'll reset.
Oh wait, no, it's not. 19 minutes. Sorry.
19.
Yeah.
Okay. Okay, we're good. Okay.
We're good.
Okay.
So you don't want to be smoking, vaping, using any kind of nicotine, because that all causes vasoconstriction of your blood vessels. And when you operate like on the breast, for example, I'm going to be cutting down the blood supply already. When I make cuts, there goes that blood supply. So then what blood supply is left behind is then affected by the nicotine, which basically tightens the vessels, decreasing the blood flow, and your nipple could literally turn black and die and fall off. And we don't want that. So
No.
with smoking, it's huge to not smoke, or prepare for plastic surgery and not be a smoker. Get rid of all that stuff prior to, and you got to be honest with your surgeon about that. Like, that's such a pet peeve. Like, they lie about that, because it will end up biting you in the butt for sure.
So with that, does it affect other stuff too, the smoking? Like, is it just
100%.
like breast surgery, or is it all of it?
100%. Okay. It decreases wound healing, causes more chances of fat necrosis, all kind of things in every type of procedure. So we actually, any board certified plastic surgeon will not operate on a smoker generally. Unless it's like a melanoma or something like that, it has to be done.
Yeah.
No cosmetic surgery on anybody who smokes.
Okay, there you guys go. It's another reason to put down the cigarettes.
Absolutely. Absolutely. In general, you just want to be eating healthy, especially after surgery, you want a high protein diet, because protein helps you heal. You want to do what the surgeon says. So if they say, walk every night, just to get some exercise in your legs so you don't get a blood clot, but let's not walk for exercise. Like, you've got to really have downtime, because, anytime we do these surgeries, like a tummy tuck or breast surgery, if you're shearing the tissue, it's going to create fluid. Yeah. And that fluid is called a seroma, and it can mess up your results. And the way you prevent that is compression and low activity. So you got to be compliant, no smoking, be as close to normal BMI as possible, and no sun. After surgery, you do not want any exposure to sun on your scars. Sun on a fresh scar for actually up to 12 months can cause your scar to turn like a dark purple, and it won't fade, and it's just terrible for healing. Wow. Most people think it's great.
12 months, huh?
It takes 12 months for a scar to mature. And that is also why we don't do scar revision for 12 months, because if you were to operate on a fresh scar, it's going to cause the scar tissue to be double and take, be thicker and take longer to heal. So ideally, we like 12 months for the scar to mature and be, done healing before we do any type of scar revision.
You just taught me something, because I didn't know the 12 months with the scar.
Yes.
I guess I need to pass that along better, because I didn't know that. Okay. All right. So no sun, no smoking. Get your weight under control, and don't be crazy after surgery trying to go back to work early or doing their extra activities early, right?
Yeah. And something else to know about liposuction is it actually takes 6 months to 12 months to actually see your final results.
Yes.
Don't do something if you've got like a wedding like in 3 weeks and you're like, let me come get some lipo. That's a bad idea.
Yes.
It's not going to look good. It actually looks worse before it looks better.
Yeah, that's a big thing. People are like, they call you like right before the thing.
Oh, yeah,
and you're like, no, like, and that's, we take our final pictures 6 months after.
Absolutely.
Like, that's like, you don't, you don't want to. And that's the other thing too. People, like the downtime, you said, they want to go back immediately. I mean, they want like instantaneous, and it's just not the way it works.
The hardest thing about plastic surgeon, usually, the clients have jobs, they're active, they go to the gym, and I make them stop doing all of that for a while, and that drives them crazy. That no one wants to sit at home, but you want to heal, and you don't want to push your body too much, because that can really affect your results.
So, I mean, you have to know those things, though. I mean, if you're really wanting something done, you need to know what it's going to actually look like for afterwards. So you kind of talked about your pet peeves there with patients not complying, and then it's just because they don't get the results. I mean, that's I mean, your job is to make things better. So if they're not doing the things to get there, it's going to be frustrating, right?
Sure, absolutely.
All right. So anything that the patients need to specifically ask their plastics, like prior to surgery, like good questions when they come into the office? Is there anything else besides what we've talked about?
No, I mean, their credentials and how many of those procedures that they do. If someone's getting a facelift, you want to make sure that surgeon is doing a couple of facelifts a week, because you just don't want to go to someone that only does Brazilian butt lifts for a facelift. I mean, just do your homework, that kind of thing.
Right.
And how much downtime, it's all different for different surgeries.
Yeah. Yeah.
But that's usually the
Those are the
basics.
biggest.
Yeah.
Okay. So let's talk about a couple of funny stories. We were kind of comparing notes like this. Okay, I should not say funny. That is the wrong word. So forgive me, audience here. But let's talk about some interesting cases that you see. We were kind of talking beforehand about something you had seen in residency related to plastic surgery that I think the audience would be like, what in the world?
Yeah,
Okay.
I mean, I saw a lot of crazy stuff as you did in the ER, and this actually happened in the ER. I was, sewing up some kind of hand laceration or something. I heard a lot of commotion in the waiting room, and a patient actually came in and went into the bathroom of the waiting room and took a box cutter and chopped off his penis. Put himself on blood thinners to make it extra dramatic, and then flushed the penis down the toilet, and then walked out into the waiting room. And I mean, just blood was spraying out of his,
Oh gosh.
out of that area all over the place. And that was really an interesting day that I'll never forget.
Yeah, you said so, and he was wanting basically to get you to change it to a vagina, right?
Yes,
Yeah, that was the point
in
of
his
flushing
that
the penis.
If I don't have a penis to replant, then I can just have a vagina. And unfortunately, it doesn't work that way.
That is not how that surgery goes.
That is not how surgery goes.
But you said the waiting room was pretty full too, and so he's spraying. There's kids everywhere.
Kids, people. I mean, everyone was screaming. It was just out of like a
got a real life
horror
scene right there.
Yeah.
I was telling Dr. Suber too. There was one I saw in residency. Somebody's neighbor got mad. They were like fighting over a DVD, and he literally took a samurai sword and like chopped off this guy's arm. Like no joke, like chopped off the guy's arm. So he comes in. There was like a little piece of skin holding his arm. Holding his arm,
man.
and I mean it was like the craziest thing. And you've seen lacerated arm, or they've like done. But I mean it's just there's some crazy stuff out there that happens. So
never a dull moment.
There's never a dull moment in medicine. But I figured you guys would appreciate a couple of those dramatic stories we've had. So as far as anything else that you want to add that we haven't covered or talked about, can you think of anything else?
No, I think we covered it pretty well.
Okay. All right. If they wanted to get a hold, like if they're interested, if they're around this area specifically, so we're in the, Dr. Suber is in the Portsmouth, Ohio area. So any of you Ohio, Kentucky folks, if you're interested or want to have a consultation, how would they get a hold of your office?
So you could call our office at 740-356-3562. Another way, we have a website through SOMC. I work at Southern Ohio Medical Center. Or my Instagram is dr.jessicasuber.
Okay.
And I have a lot of my before and afters there. And that's another way to get a hold of us.
So yeah, this was a great one talking about all the plastic surgery questions. So if you guys have anything further, want to see some of the work she's done, don't hesitate to get on there and follow her on Instagram. And as always, we'll end with a quote. I've got a couple funny plastic surgery quotes to end with here. So this is from Groucho Marx. He said, "She got her looks from her father. He's a plastic surgeon." And then from Dolly Parton, "Plastic surgeons are always making mountains out of molehills." So I'll leave you guys with that, and we'll see you next time.
Thank you.